Then we have the type 2 diabetes mellitus. Now over here, we are dealing with patients belonging to the adult age group. The underlying pathophysiology over here is the relative insulin deficiency and rather the insulin resistance, which is the major cause. So what are the risk factors and the predisposing causes? The genetic predisposition is seen in these patients, but the genes involved have not yet been identified. The environmental factors such as the low birth weight, and at 2 months of age, the concept is that at very early age, there is poor nutrition that is going to hinder the development of beta cells. There are certain risk factors that may increase the development of diabetes mellitus type 2. That includes obesity, inactivity, family history. Then we have race and ethnicity. Now, although it's not clear why, but Black, Hispanics, Native Americans, and Asians are more at risk of developing type 2 diabetes. Then there are the increased blood lipid levels. We have the risk of getting type 2 diabetes that increases as you get older, that is after 45 years. So always keep in mind these risk factors when you are treating the patients or when you are diagnosing the patients with type 2 diabetes. Let's move on to the pathophysiology of type 2 diabetes, for which we think this metabolic syndrome is somewhat responsible. So now let us understand what this metabolic syndrome is. Just remember that the person should have at least 3 or more of the following to fit in the scenario of the metabolic syndrome. The person has glucose levels more than 100 milligrams per deciliter, triglyceride levels more than or equal to 150 milligrams per deciliter, HDL levels in females more than or equal to 50 milligrams per deciliter, and in males more than or equal to 45 milligrams per deciliter. Regarding the blood pressures, they have to be more than or equal to 130 by 85 millimeters of mercury. Lastly, we have the BMI. For females, it has to be more than or equal to 35, and for males, more than or equal to 45. So all of these components of metabolic syndrome contribute towards what is called insulin resistance. One more important aspect can be a genetic component, and another thing is the ethnicity that can also be included towards, which is basically contributing towards the insulin resistance as well. So now let me explain this insulin resistance. Getting back to the story where we started, through the same mechanism, insulin is released. It goes and gets attached to the insulin receptors. But what is going to happen now? These receptors do not respond well to the insulin attachment. As a result, there is a decreased intracellular response. Again, decreased expression of glucose transmitters and resulting ultimately in increased glucose levels. Now, let me explain to you that how this insulin resistance develop in individuals developing the type 2 diabetes. First of all, there is a genetic defect of mitochondrial decoupling protein. Now, this kind of a genetic predisposition is going to ultimately result in a decreased substrate uptake in these individuals. Now, as a result, it is going to increase the fatty acids inside the body. The increased fatty acid metabolism or lipolysis is going to ultimately result in increased levels of ketone bodies. Ultimately, the person can go into DKA, that is the diabetic ketoacidosis. These increased levels of ketone bodies can contribute towards the process of insulin insensitivity in these individuals. Now let's move on to another mechanism. Now there can be a genetic predisposition through which the person can develop decreased lipolysis, and that is going to result into obesity in these individuals. And now we remember that I've already mentioned that one of the factors of the metabolic syndrome was obesity, which is basically a risk factor for the development of type 2 diabetes. So in obese individuals, the food intake is increased and there is a decreased physical activity, which is resulting in an imbalance between the energy supply and expenditure. There is an increased fatty acids and decreased glucose utilization. All of these are again going to contribute towards insulin insensitivity as well as a downregulation of insulin receptors. So all of these events are going to contribute towards hyperglycemia in patients of type 2 diabetes. So I hope this mechanism is now clear and you'll remember how insulin insensitivity develops in patients of type 2 diabetes. Now, even without genetic predisposition, there are certain other causes that can contribute towards the development of type 2 diabetes. So let's dig into the details. What are the factors contributing towards the development of this condition? Certain conditions, such as abnormal insulin release in certain individuals, removal of pancreas due to multiple causes, such as it can be carcinomatous conditions. Then we have pancreatic diseases, which includes acute and chronic inflammations of the pancreas, and it can be even the toxic damage to the cells of the pancreas. The mechanism remains the same because the beta cells will get destructed and is going to result in the decreased levels of insulin in the patients. Then we can have post-receptor defects. The insulin will get bind to the receptors, but the response is not going to be favorable in these patients. Thirdly, we can have anti-receptor antibodies. That is ultimately going to result into a decreased response to the insulin in these individuals. Now we have certain antagonistic hormones that can be increased in certain infectious states, and which is ultimately going to release these antagonistic hormones, and thus the manifestation of diabetes mellitus during these infectious states. On the other hand, these antagonistic hormones can also be increased in certain other conditions, such as patients of acromegaly usually present with diabetes. Even in Cushing's syndrome and stressful conditions, the patients usually present with diabetes. The mechanism remains the same. Because of the release of these hormones, the patient is ultimately going to result or develop the type 2 diabetes. The release of progestogens and choriomammotropins in pregnancy is again going to contribute towards the development of type 2 diabetes. Thyroid hormones and glucagon also act as an antagonistic hormone to insulin. Conditions such as somatostatinomas can also cause diabetes because somatostatin secreted by it inhibits the release of insulin. Now, what are the take-home points over here? Let's conclude this discussion regarding diabetes mellitus by comparing these two major types, that is the type 1 diabetes with the type 2 diabetes mellitus. Now, when we compare the underlying pathophysiology, the major concept over here is that the type 1 patients will have the absolute insulin deficiency versus the type 2 diabetes in which the patient is suffering from insulin resistance and rather relative insulin deficiency. Now let's compare the age of diagnosis. In type 1, the patient is usually less than 30 years, and in type 2, the patient is usually more than 45 years. Then we move on to the symptoms of these two conditions. In type 1, the patient would suffer from increased thirst, urination, weight loss, fatigue, a fruity smelling breath, which is due to the production of the ketone bodies, irritability, blurred vision, slow healing sores, and frequent infections. On the other hand, in type 2, the scenario would be like the patient presenting with increased thirst and urination, weight loss, fatigue, blurred vision, slow healing sores, and frequent infections. Now, while we compare the prevention in these two cases, there's no way to prevent type 1 diabetes. While in type 2, most cases can be prevented, as we saw the major causes contributing towards metabolic syndrome were responsible. So if we avoid these causes, that can ultimately result in the avoidance of the development of these particular condition. So that is all when we compare these two conditions, type 1 versus type 2. So do remember these key points while you're treating these patients.